Good afternoon. It is Friday, and that means it is time for our lunch and learn. Now, today, this really speaks to my heart because we see this all the time in the clinic, and people will come in and they will say, I've got XYZ disease, and my doctor says it's incurable. I have these medications, and they cause side effects, which give me more medications, and I just want to try a different approach. And so we deal with this all the time, and I'm glad to bring this to our collective attention because most people do not understand the way the body works with the disease process. If you can unravel the disease process, and we can, right, then you can heal yourself from any disease. And so it's not necessarily that holistic practitioners heal you. According to the state of Texas, I live in the state of Texas, the only people that can heal you are people who have a medical degree. They are medical doctors. So the state law says that if you treat or cure any disease using anything other than pharmaceutical medications, then you are practicing medicine without a license. So there is that in the lovely state of Texas. However, what people don't realize is that holistic practitioners do not treat diseases. They help the client regain their health. And when they regain their health, then there's no such thing as disease. So this is what I want us to have in our mind. Our body is a survival organism. It wants to survive. If it's not surviving or if it's having trouble surviving, then there's something that we are missing. And so the key to regaining your health is to find out what you are missing. And a lot of times it's just nutrition. I read an article yesterday about dementia. If you've been watching us for a while, you know dementia is like on my mind because we're dealing with it with family members. And the report said that the simple nutrient of B vitamins, if there is a deficiency, then the person can have dementia. And so what do we want to do? We want to make sure that all of us have the vitamins that we need, that all of us have what we need so that we are not going to break down. So this article that I'm looking at today is written in the first person perspective. This is not my story, okay? It's somebody else's story. I don't know whose it was. There's no name to it, but this is the story. So we're going to get to some statistics and some reports after we tell you the story. I hope the story is going to encourage you. I hope the story is going to show you that you don't have to settle for being saddled with a disease label. You can change your mind and you can change the way your body functions. So there's nothing more that we can do, my doctor said. I was in my 30s and struggling to get out of bed most days because of debilitating pain and weakness. After seeing countless doctors and undergoing endless tests for more than 2 decades, I was told the symptoms were in my head. Now, this is in her 30s, okay, for 2 decades. So that means since she was a teenager, she's been dealing with this. That's a long time to deal with any kind of sickness and disease. She knew that the symptoms were not in her head, and she knew that something was really, really wrong, but she also refused to believe that healing was not possible. And that's what we need to do. We need to have a mindset that says, I'm not sure what's going on in my body. However, I trust that my body has the ability to heal, because most of the time it does. You just don't know how to make it work. She goes on. She says, so my husband and I became co-detectives, scouring scientific literature and theorizing that my health issues stemmed from a leaky gut triggered by gluten and man-made chemicals such as genetically modified organisms, pesticides, and herbicides. Switching to an organic, gluten-free diet, I tried protocols such as the gut and psychology syndrome diet, the elimination diet, and the candida diet, but the symptoms just worsened. And my food sensitivities grew so severe that even healthy foods such as apples and bananas made me feel sick. Despite cooking everything from scratch and eating exclusively organic, my health continued to decline. Now, why would this happen? I'm going to tell you why this happens. This happens because even though she's making good choices with her food, her gut is so messed up, it can't do anything with the nutrition that she's given it. So this is why almost 100% of the time when someone comes in to see me, we start with a gut health protocol. All right. We know that if the gut and the brain are not connected, then you're not going to get the results that you want. And so this lady, just food alone, she's not getting the results that she wants. In fact, she says her symptoms are becoming worse. She goes on. At rock bottom, I spent most days lying on the floor, too weak to climb the stairs or even stand long enough to wash a single dish. My body ached so intensely that I couldn't wrap my hand around a cup. My ribs felt like they might break with every breath, and I began to lose muscle, 15 pounds in a single month, despite eating almost constantly. So what does that tell us? That tells us that even though she's eating and she's eating good food, she's not absorbing that. So that means there's something in the gut that's not working properly. She said, I knew I wouldn't live to see my kids graduate from high school or get married if I didn't stop the deterioration. And Western medicine did not have any answers except medication. She goes on, I surrendered to God. That's always a good thing. We pray for our people every day. We pray for all of our clients. We pray for healing strategies. There are all kinds of strategies, but if you don't have the right one, then nothing good is going to happen. So surrendering to God is a very, very powerful statement. She goes on, he led me to a functional medicine doctor who diagnosed me with advanced stages of autoimmune disease, rheumatoid arthritis, accompanied by arsenic poisoning, leaky gut, and life-threatening nutrient deficiencies. So this is all really, really serious. All right. An autoimmune disease is a chronic disease, and your medical doctor will tell you that there is no cure for it. But what that really, this is how you need to hear that. Don't hear there's no cure for it. Hear, I don't have a medication to give you that will cure you, because that's what that means. When doctors say that something is incurable, they just don't know what medicine to give you in order to help you. Now, we know that most of the time, medicine is given to you to take away a symptom. If you take away the symptom, that does not mean that you have healed yourself from the disease, all right? Think about your car. You're driving your car and a check engine light comes on. Well, you've got two choices. You can go down to the auto place and have a mechanic check it out, or you can just go under the hood, pull that bulb out, and guess what? You know, you're not going to have that notification anymore. And that's really what medications do. It's like pulling the bulb out so you're not getting the notifications. A symptom is a healing strategy. It brings to your attention, it brings to your mind that there's something in the body not quite right. And so what do we need to do to correct that so that we can move in the right kind of way? Now, the doctor said that she had nutrient deficiencies. And we know, if you've been listening for any length of time, we know that our food supply is very poor in nutrient density. We know that the last studies that I've been able to find have been in, I think it was 2002, I think. And they compared 2002 nutrient density to 1985 nutrient density. And they found that in 2002, almost all fruits and vegetables had lost approximately 70% of their nutrient value. That means that we're all having issues because we're not able to get all of our nutrition from our food. This is why in the clinic we use the scanner. It's called the Pharmanex PS3 scanner. We use this because you can take just your skin right here, put it on that laser, and that laser is going to read the amount of carotenoids in your skin. What does that mean? Break that down. Your carotenoids, you get the bioflavonoids from your fruits and vegetables, your dark-colored fruits and vegetables. So potatoes don't count, rice doesn't count, bananas doesn't count. It has to be dark color, okay? So what makes those dark colors are the bioflavonoids. The body absorbs those bioflavonoids, turns them into antioxidants. The antioxidants go after free radical damage and also stop you from aging. So it's really, really important that we have a diet high in bioflavonoids. Now, as I said earlier, most of our fruits and vegetables do not have high nutrient dense qualities in them. I mean, they're very poor. And so this company, Pharmanex, makes vitamins that are made out of fruits and vegetables so that you are getting all that you need from a handful of pills, okay? But they're made out of whole ingredients that we should be eating, which most of us don't, me included, right? But I take those vitamins to make sure that all things are good. So nutrient deficiencies is one of the things that hurt her. Leaky gut, we talked about that. That's when you have little cells in your gut that are closed like this. When you've got leaky gut, they're open, and your food, your undigested food, can slip through those little junctures, and that undigested protein gets into the blood supply. The blood supply thinks you've got some kind of an allergy, some kind of a foreign body, and so it mounts an immune response, and that starts the whole cascade into autoimmunity if you don't get that resolved. So there are a lot of things that we know, we professionals, we know how to unravel that so that we can get you back to your health. She said that the diagnosis felt like a death sentence, branding me with the label of autoimmune disease forever. With conventional medicine offering only symptomatic management and no hope for full recovery, it was a crushing reality to face. I changed my perspective by refusing to let the label define me. I also believed that if lifestyle choices had contributed to the illness, those same choices could lead me to the power to heal. And that is really, really good thinking, because it is the lifestyle choices that we make. We smoke, we drink, we eat sugar foods, we eat processed foods, we don't rest, we have a lot of drama in our life. Those are choices, all right? All of that leads down the path to sickness and disease. But we can change that. We can quit smoking. We can monitor drinking, whatever that means to you, all right? Soda, coffee, those things are just as detrimental as over-drinking alcohol, because the soda has chemicals in it and the coffee also can have chemicals in it, and they're both dehydrating. If you're not hydrated, then you're going to have real problems with getting your body to work the way they need to. She goes on to say that 9 years later, she's not just in remission. I am fully healed with bursting energy that I had in my 20s. So this is a really, really good story. It's a hopeful story, but it took her 9 years to come out of that disease process. Now, we have seen people here in the clinic with autoimmune disease. We've seen them with leaky gut issues. We've seen them with just really, they're just malnourished. I'm just telling you, with professional guidance, it doesn't have to take you 9 years. But what you do have to do is you have to make your mind up that my body has the ability to heal. My body has the ability to get well. If I feed my body the nutrients that it needs, then my body's able to do what it needs to do. And so that's kind of what we need to understand with our mindset. So the article goes on to say, while conventional medicine excels in treating acute trauma, it often approaches chronic autoimmune conditions as a lifelong sentence to manage, largely through medications, rarely offering the possibility of true healing. And yet, scientific literature is full of a different story, with numerous case studies and clinical trials demonstrating that chronic conditions can, in fact, be reversed. So I like this because there is scientific evidence out there. It's just not anecdotal evidence. It's just not me telling you that. It's scientific evidence that is out there that these things can be reversed. Now, the first thing that the report talks about is rheumatoid arthritis. Now, there's two kinds of arthritis. There's arthritis where you have calcium deposits in your joints. And then you've got something called rheumatoid arthritis, where your joints swell and they're very inflamed and they're very, very painful. And that is an autoimmune disease, all right? So she says she reversed her autoimmune arthritis through lifestyle changes, including a high-fat, grain-free diet, and a positive mindset without relying on medications. Now, nearly a decade later, she remains free of the disease. The dietary changes can play a powerful role in reversing rheumatoid arthritis. In a 2021 clinical trial that was published in Nutrients, it reported significant pain reduction and improved physical and mental health in rheumatoid arthritis patients after 3 months of a gluten-free, lactose-free, and meat-free diet. I'm just going to tell you, I'm a carnivore girl, and if I had to give up meat, I would sorely miss it. However, I do believe that if I was in constant pain, which rheumatoid arthritis, I've got family members that have that, it is extremely debilitating. And if I got off the gluten, got off the dairy, got off the meat, and my symptoms went away, I think I could handle that. All right, but not many people are going to tell you that in the medical field. In a 2014 review in Cell Metabolism, it highlighted fasting as a method to reduce inflammation and pain. Combining fasting with a vegetarian diet has also demonstrated success in alleviating symptoms according to a 2-year clinical trial. In 2002, a clinical trial reported reduced pain, better physical function, and increased vitality following a Mediterranean-based diet as compared to the Western diet. So, cancer. A lot of people, when they hear cancer, they say, oh my goodness, it's incurable, and unless I get a miracle, right, things are not going to turn out well for me. So, the studies show that spontaneous tumor regression, where tumors shrink and disappear without conventional treatment, and tumor reversion, wherein the cancer cells revert back to normal cells, have been observed in humans for centuries, according to a 2024 review in Cancers. That's a journal. Fasting and fever were noted as potential triggers for cancer reversal. In a 2011 review in the Journal of Natural Science, Biology, and Medicine, it affirmed that spontaneous healing from cancer, quote, is now accepted as an indisputable fact and is not rare. Now, where have you heard that before? You haven't heard it. All right. All we hear about cancer is it is pretty much a death sentence unless you go and you get chemotherapy and you get radiation and all that kind of thing. And we know that chemo and radiation hurts all of your healthy cells as well. And we know that the outcomes for a patient doing radiation and chemotherapy are not as good as someone who just decides to live with the cancer. We know that they live on average 4 to 8 years longer than somebody who pursues their traditional cancer treatment. So that's something to think about as we get older and things start to happen. That's just something to think about. Even our bodies, if it is accosted with cancer, because I do think it is an assault, if we do the right things with our body, we are able, according to scientific evidence, we are able to allow our bodies to change the structure of the cells, and we are able to heal naturally. Now, does this happen overnight? Sadly, no. It takes about 3 years to heal yourself of cancer on a holistic model. Now, a lot of people are just too afraid to deal with that. I know that when my mom had cancer, we had sent her to a cancer clinic in Mexico. I happen to know the doctor personally. He's American, educated, trained, all that kind of stuff. But he cannot cure cancer effectively here in the United States because of the way that he does it. It's not allowed here in the United States. So, long story short, my mom went there, and she had a really, really good response. She came home, and every time she had her blood work done, I think it was the CA24 test. That might not be right. It's been a few years. Anytime that test would come, the number would be lower, which means that her body was healing, but it was still above normal. And unfortunately, her husband and her medical doctor pretty much pressured her into the traditional chemo and radiation, which has caused undue stress, and it's ruined her body, actually, is what it has done. And so nobody told her that it would take 3 years to heal from cancer holistically. And so people are pressured because all of this information is not available. And so I'm trying to let you understand or give you snippets of information. So if, God forbid, this happens to you or your family, you've got some information so that you can make the right decisions. So the heart disease in a landmark clinical trial in 1998, and that was a minute ago, demonstrated that lifestyle changes can not only halt, but also reverse coronary heart disease. Now, we do know that coronary heart disease is one of the fastest growing medical conditions that we have here in the United States. The randomized controlled trial divided patients with moderate to severe coronary heart disease into two groups. The usual care group and the experimental care group, who went intensive lifestyle modifications, including a whole foods vegetarian diet containing 10% fat, aerobic exercise, stress management, smoking cessation, and group support. After 5 years, the group receiving standard care demonstrated increased blockage of the arteries, which could lead to chest pain and heart attack because the coronary arteries feed the heart. In contrast to that control group, right, those that engaged in the lifestyle changes demonstrated a reduction in the blockage of coronary arteries and fewer cardiac events. Recent trials on the Mediterranean diet suggest that healthy fats may play a more significant role in preventing cardiovascular mortality and heart disease rather than the traditional low-fat, cholesterol-controlled diets, low cholesterol controlled, according to a 2020 review in Nutrients. So, let me break this down for you. If you are a heart patient, they're going to put you on cholesterol-reducing drugs, which is going to reduce the amount of cholesterol that your body makes. This study found that the people that ate a high-fat diet, and a high-fat diet is going to help your liver produce more cholesterol. And now we need to kind of break that down a little bit, because there's your LDL, which is quote-unquote bad cholesterol, and then there's your HDL, which is your quote-unquote good cholesterol. With my worldview that God is a good God, if your body makes it, it's got to be good, okay? So the low LDL, low density lipoproteins, if those are high, that means that you are dealing with an inflammatory process in the body, and the body is making more LDL in order to protect you from that inflammatory process. The HDL is the healthy cholesterol that we do want to have, but your liver has to be healthy in order to make that. And so this particular article says that the high fat, right, diet is better than the low fat, low cholesterol model that the medical professionals are currently prescribing for cardiovascular patients. So look it up for yourself, see what you think. Okay, you can read these things too, and you can look at these medical studies. Now, it's not easy reading. By far, it's not easy reading. However, as you scroll down, you can look at the conclusions, and the conclusions are a little bit easier. It will say, according to these statistics, blah, 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 which almost everybody can understand that. You don't have to read the whole thing or understand the whole thing, but it's good if you can. In 2024, respective case studies published in Frontiers in Nutrition documented the reversal of major depression and generalized anxiety disorder in 3 adults following the ketogenic diet. Complete remission was achieved within 12 weeks. Now, thank God, I have not really had general anxiety disorder, panic attacks, and those kind of things, but we have that every single day here in the clinic. I just had a Facebook message from a lady that says she's got driving anxiety, and she's got to figure out where things are so she knows if she can make it that far, if she's going to have a driver. So these kind of things are very, very debilitating. And you know what the key component to anxiety is no gut-brain connection, okay? Your gut is so messed up, bad foods, too much sugar, heavy metals, H. pylori bacteria, SIBO, leaky gut. I mean, the list is endless, okay? But when your gut is not right, you are more prone to anxiety and panic attacks. The diet component shows that when you eat the right kind of food, the complete remission, okay, can be had in 12 weeks. Now, the ketogenic diet is basically fat, all right? A lot of people think that the ketogenic diet is all protein. No. A proper ketogenic diet is 73% fat, 20% protein, and I think 7% carbs. Okay, so you can Google that. That information is out there. A lot of people get confused with a ketogenic diet and an Atkins diet. An Atkins diet is pretty much all protein. So we know that the fats that we eat in our food help alleviate cardiovascular disease and also help alleviate depression and anxiety. In a 2023 Umbrella review, they reported that exercise reduced mild to moderate depression and anxiety in adults, matching or slightly surpassing the effectiveness of standard medications. All forms of exercise studied, resistance training, aerobics, yoga, and a combination was all beneficial. Aerobic exercises are also shown to reduce depression in a 2024 review. Exercise, and I know not very many people like that word, exercise helps improve the levels of your feel-good chemicals, like your endorphins, all right? So that helps alleviate the symptoms because you've got those neurotransmitters that are doing what they need to do because that's what exercise does. And it says that it reduces the anxiety-causing neurotransmitters, which are norepinephrine and acetylcholine, I think. That might be right. So Alzheimer's disease, right? So we're always talking about losing our cognitive ability as we get older. Cognitive decline in the early stages of Alzheimer's disease can be reversed according to a 2016 study published in Aging. Using a personalized holistic therapeutic program, some patients achieved significant cognitive improvement, with some regaining normal function and even returning to work. So let me break this down for you. They got a personalized, holistic therapeutic program. That means they had a professional who would analyze them, assess them, give them the nutrients that their specific body needed. There's no one size fits all, and that's what they want. They go to the doctor, say they have the flu. You go to the doctor, you get a flu shot. Everybody that goes to the doctor gets a flu shot. That's standardized care, and that is not specific to the unique individual sitting right in front of me. And so this report is saying that if you have cognitive issues and you get personalized, holistic therapeutic support, you can actually reduce that, reverse that, and carry on a normal life. So this is important. In one case, a patient's brain volume in the key area called the hippocampus, which involves memory formation and learning, increased from below average on the 17th percentile to above average on the 83rd percentile in just 10 months. So this was associated with improvements in memory and learning. Now, why is this important? This is important because we're so used to going to the doctor and you take a pill and in a few hours you feel better. Doesn't work that way with holistic. But if I were facing Alzheimer's and cognitive decline, you can bet that 10 months of my life would be a small investment to make if I'm trying to reverse a disease that could just basically, incapacitate me for the rest of my life. Okay? Single drugs have not been able to reverse Alzheimer's disease. Instead, combined treatments targeting stress, diet, physical activity, and environment may hold the key to reversing these diseases, according to the authors of this study. A 2023 review also reported cognitive improvements with early onset Alzheimer's through a personalized, holistic approach. So type 2 diabetes, and we love type 2 diabetes people because this is one of the easiest things in the world to reverse, okay? You've got to change your diet. You've got to change your lifestyle. You've got to exercise. You've got to do those things that are within your control. But in just a few short months, you cannot be diabetic anymore. And so we see this all the time. I think I said the other day on a video that we had a contact, even from another state, who reached out, sent me the blood work, and the guy had absolutely no idea that he was diabetic. When he had his blood work done for years before, he wasn't diabetic, but now his A1C was 12.8. That's really bad. It's not supposed to be over 5.7. If you don't know, it's not supposed to be over 5.7. So we put him on a personalized, holistic therapeutic protocol, and within 1 month, okay, 1 month, his A1C had come down to full points, right? So that is very, very encouraging when you're facing these debilitating diseases. We know how to unravel them. Not two people are the same, and we've got to work with you as an individual. Lupus is another autoimmune disease. In a 2016 study published by Arthritis Care and Research, it examined the occurrence of complete remission in lupus patients over a 32-year period. Nearly 15% of patients achieved complete remission for at least 3 years, while 4.3% sustained remission for a minimum of 10 years. Complete remission was defined as living symptom-free with normal lab results and no need for medication. So reading between the lines, the people for 3 years, they stuck with the diet and they stuck with the supplements and they stuck with the things that did work. The people that achieved remission for 10 plus years, they stuck with it longer, okay? They didn't go off the wagon because it gets tiring having to monitor everything, and I get that. But you've got to decide what is your health worth, okay? So the last disease, I know I'm going over a little bit and I apologize. The last disease is ALS, and this is also known as Lou Gehrig's disease, and we do see this. We don't see it often, thank God, but we do see this. In a study in 2016, there was a study published in Neurology, and it analyzed data from 3,132 patients with ALS. They found that 7% achieved a plateau in disease progression over 18 months, while less than 1% showed reversal. Although the latter number is very small, it does demonstrate that reversal is possible. Since then, Dr. Richard Bedlick, lead researcher of the study, has confirmed 62 cases of ALS reversal, including people who breathed independently after using ventilators, people who were able to walk without assistance after being confined to a wheelchair, and people that were able to speak unassisted after relying on speech devices. So these are some really critical diseases, and these reports show that you can reverse this with your intention, with your mindset, and with personal, holistic, therapeutic help. So that's a lot to digest. It is the weekend. I'm getting ready to go and do the things that I do on the weekend, which is rest, recover, restore, rejuvenate, all those things. And I want you to do the same, and I will see you next week.